Some tests are only accurate for every 1 in 25 results, but can be much more accurate when followed up with another test that clarifies the findings. So knowing what tests to do and not do is something you and your doctor can decide on, but you'll need to ask the right questions before you give birth. Hi, this is Dr. Hobbs, restoring hope and health by finding the cause and the right combination for lifetime family wellness. So remember, pregnancy, birthing, and parenting are not a medical process. They're a natural process that should be supported and intervened in only when necessary. Now, tests can help you know when it is necessary. So most of this info is from Chapter 7 of the book, How to Have Well-Adjusted Babies, which is linked to in the description below. So the first thing to start with is an attitude. Of course, be kind and humble, and be confident that your questions are important, requiring an answer that's both clear and accurate. Now, some tests are routine and frequent, being done every visit. For these, there's really no risk, so questions are just to fulfill your curiosity. These include urine collection, blood pressure, abdominal palpation, baby's heart rate, mother's weight, and checking for mother's swelling. Now we get some of the blood tests. So this first group is blood group and RH factor. You've probably heard of that, right? So if you're RH negative, it could cause problems during your second pregnancy. It's good to have the info about that, and good to know what it is. So this next set of tests is for infections that will test for rubella antibody. So vaccines for rubella are recommended for every woman before birth by the CDC, because during 2005 to 2018, 15 babies with damage related to rubella infections have been reported in the United States. So 15 that period of time frame. Now, one is too many, but it's only a risk if you have an active rubella infection during pregnancy. So I included a link about the Tdap and influenza vaccines. I won't tell you what to do, but we do want to give you all the relevant facts to ponder. They'll also test for syphilis, hepatitis B, and AIDS. These are infections that are often passed to the baby if the mother's infected. Next is a deficiency test. So the first is the hemoglobin level. This is a check for anemia, which is not having enough red blood cells to carry oxygen for you and your baby. If you've ever seen someone really crave ice, there's a good chance they are anemic. So why ice? I don't know. But this is a common sign with moderate to severe anemia, usually due to iron deficiency. But it can also be from B12 or folic acid deficiency. So this next one is an excess test. It's glucose. You can get diabetes more easily when you're pregnant. This can harm you and the baby. So you'll need to be super strict with diet, and in some cases may even need to take insulin. So finally, you may have more intrusive screening tests recommended. These are the ones you'll want the 7 questions for. So here are the 7 questions. Number 1, what is the purpose of this test? Simple enough. Number 2, how is it done? Number 3, what risks are involved for the mother and the baby? Number 4, how accurate are the results? That's important to know. Number 5, how will the information gained influence your pregnancy process? So we think about this with all tests, right? It's like, great to have the information, but what are we going to do with it? Number 6, what will happen if we don't do the test? And number 7, how much does it cost? So with the rest of these tests, usually what they're looking for is the probability of birth defect in a developing baby. So one is the electronic fetal monitoring, which tracks the baby's heart rate. It's not very invasive, but definitely intrusive. Next is ultrasound. This is also minimally invasive and provides good information, but it's not a toy to do all the time. And finally, you may have 2 more invasive screening tests recommended: the alpha fetoprotein, or AFP, or the triple T test for spina bifida and Down syndrome. So this test has a false positive of 56 out of 57 times for those under 37 years old, although it can be confirmed in other ways. So these last 2 are often confirmed with ultrasound and a more invasive amniocentesis. Now, being invasive, it may increase the risk of miscarriage, infection, and certainly distress. But then not knowing can cause distress also. And distress, either way, is not good for the baby or the mother. So you have to weigh the options and for you and your baby's needs to determine what will be best for all. All right, have a great day, and may God bless you and your baby.